Have you ever wondered at what age your children should see the orthodontist? And this answer may surprise you just a little bit. Hey guys, it's Dr. Nate at Thrive Dental and Orthodontics, and today I'm going to talk to you about everything that has to do with when your children should come see me or your orthodontist. So let's go. The age that your children should come see me or your orthodontist is the age of 7 years old. And I know that seems a little bit young, and you're probably asking me or trying to ask me, why do they need to come see me or your orthodontist so early? And it's because there are a couple things we can do early on to avoid big complications in the future. There are multiple things. There's probably 7, 8, 9 different things that we are looking for that we need to correct early on before they get into adulthood. You know what? You can probably correct some of these things when they become an adult, but you're gonna have way more issues. Some of the times you're gonna need to take out extra teeth. Some of the times you're gonna need to do a jaw surgery. And a jaw surgery, as I have probably talked about in previous videos, is no joke. And that is when you're at a hospital or the oral surgeon's office and they do this big jaw surgery and you are out for weeks and weeks and maybe months. And so we're trying our best to avoid things like this. So what are we specifically looking for in your children at the age of 7? And just keep in mind, we may or may not put braces or may not do treatment at this time, but it's always nice to see them early on. And remember, the consults are so easy. All we do is we take an x-ray of the whole mouth so I can see all the teeth that are coming in. I can see the adult teeth, I can see the baby teeth, I can see the condyles, all these different aspects of the anatomy that I'm looking for. And then I honestly just take a mirror and I take a look in that inside, and that's pretty much it. So the consults are super duper easy. And remember, at Thrive, probably a lot of these other offices, they're free. So there's really no reason not to come in because it's just so darn easy. So what are we looking for more specifically when your kid is only 7 years old? We're looking for a couple things. Number one, we're looking at the bite. So there's a lot of different things that could be off that we need to correct early on that will make his or her life so much easier in the future. Number one, we're looking for if they have any habits. Do they suck their thumb? That's a big no-no. That should have been done by the age of 2 or earlier. Pacifier, same thing, because what can happen is they can develop an open bite. And an open bite is when you're trying to bite down, but your teeth don't come together. You know, if you catch it early enough, you can correct it and it may just spontaneously correct on its own and life is good, everything's gravy. If you do not diagnose the open bite early, it can last their whole lives. And if they want to correct it later, if it's too bad, they're gonna need a jaw surgery to correct it. So that is no bueno, we don't want that. Number two, we look for crowding. You may think your children have a perfect bite, the teeth look super pretty, but that could actually be really bad. And why is that bad? Because the baby teeth are itty bitty little guys and the adult teeth coming in are bigger guys. So if the teeth look really nice and pretty, no spacing right now, that is actually a bad sign. I know it kind of sucks, but that is a bad sign. If your kid has beautiful teeth, that is a good indication that in the future, their teeth are gonna be super crowded. If they have spacing everywhere, I know you might not like that, but that is actually a really good sign. That means the adult teeth are probably gonna have space to come in, and that is great. We're also looking for things like crossbite, and crossbite is when the jaw is kind of shifting to the side. And you really want to correct this early, because if you do not, their jaw can actually continuously grow to the side. And sometimes you may see people like that where their jaw is kind of like this. And you can correct that sometimes, not all the time, but you can correct that when they're young. If you get the jaw in the proper position, then ideally they're going to grow in the correct way and they won't have all these asymmetries. We're also looking for if baby teeth have fallen out too early, because if they have, what will happen is the two adjacent teeth may come into that position, and when the adult tooth is trying to come in, it may not have room, and not having room is bad. Because if it does not have room, it may get stuck. And you may have heard me talk about this before, but then they may need something called an exposing bond. And that is a different type of surgery where they go up there, they uncover that tooth, and we're allowed to bring it in. But there's a bunch of different things that we're looking for at the age of 7. You're right, we may not be putting braces on, but we may use other appliances. Another actually good example that is probably the best one or the most common one I look for is an underbite. So that's when your bite is like this. You know, you have a big underbite, and that can actually be corrected early on, and that cannot be corrected as you get older, and that's because the maxilla or the top jaw is pretty malleable. You can move it around pretty well when they're maybe like 7 to 8 to 9 years old. Once they get to that 10, 11, 12 range, it's getting really tough. And then beyond that, it's basically impossible. You're just gonna need a surgery. So if your kid has a slight underbite, very, very important to go see your orthodontist early on. So you were saying, okay, Dr. Nate, I know I have to go in for this consult. I know I have to take my kid in early on. So what does that mean? Are they gonna have braces from like the age of 7 all the way to the age of 14? And the answer is no, of course, I'm not gonna torture them that much. I would never do that. So there's something called phase 1 treatment versus phase 2 treatment. And phase 1 treatment is when he or she has a bunch of baby teeth and some adult teeth, and we're going in there and we're trying to fix something. So no, potentially if they have an underbite, we'll give them an appliance to help that underbite. If they're missing teeth, we're gonna give something to open up the spacing. And most of the time that phase 1 takes around a year or so of treatment, and then they're done. So if they come in and they are at the age of 8, we'll finish at maybe 9, 9.5, and then we give them retainers. And we just let them go with the retainers. We let the adult teeth come in, we let the baby teeth fall out. And then when they're around the age of 13 or so, we will check for phase 2. And that is when all the adult teeth are in, and we get to see if we want to do a phase 2 treatment. In general, that phase 2 treatment is shorter because we've done something in phase 1 to help their growth or help the teeth come in. So that phase 2 is a little bit shorter. There you have it. That is all you need to know about when you should bring your children in to come see me or your orthodontist. Remember, it's around the age of 7. Maybe a little bit later, but roughly around that age. And why are we doing that? No, we're not gonna slap braces on the patient right at that point, probably, but we're looking for some things. We're looking for if they have an open bite, if they're missing teeth, if they have a cross bite, if they have an underbite, overbite. There's all sorts of different things we're looking for to make sure that we can correct those things early on to make it so that their life and their growth is so much easier in the future. And remember, these consults are super duper easy. And are they free? Yes, they are free. So come on in because it's super easy. We take that x-ray, I take a quick look inside very fast, and it also gets them just used to being in our office and seeing their orthodontist. So there you go, that's everything you need to know about when you should bring in your children to see the orthodontist. If you have any value in this video, please subscribe, please comment below, because as you know, I'm trying my best to answer all your orthodontic or dental related questions. And I will see you guys in the next video.